Quick overview of India's war against COVID. Here are some figures and numbers that are useful as we understand what lies ahead. As far as vaccination is concerned, 70% of India's population is now fully vaccinated. By 2021 is what happened. China, only 66% of those over 80 have completed primary vaccination. As far as lockdown is concerned, India had a careful strategy of lockdown to normalcy over several months in 2022. China defied global logic and continued with its terrible and absolutely disastrous zero COVID policy that has brought them to the stage they're in right now. Post-lockdown policy, India, restrictions were removed systematically and scientifically. In China, zero COVID policy was abruptly scrapped without any plan B. So the difference between how India and China have dealt with the key decisions and policies of the COVID pandemic are clear for everyone to see. India was way, way ahead of China in this. Now, with COVID cases rising uncontrollably in China in what is clearly its first wave, it seems that the world will have to unite once again in its fight against the Chinese virus, because the battle is clearly not over. But as we gear up to face what could possibly be a fourth wave, I'm hoping it's not, it's also important to remind ourselves of what impact the world faced due to the massive failures of this man and his team. Everyone knows this face. Many of you know this organization. Most of you know his name as well. Dr. Tedros and the World Health Organization, their epic failure has brought us to this pass. What's this updated report?
It's not just important for other countries, it is important for other countries that US supports.
Everyone recognizes this face, a household name, thanks to the COVID pandemic.
The freezing of the funding will be reconsidered.
WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
Even the latest COVID crisis in China is being directly linked to the WHO's breathtaking incompetence and cowardly unwillingness to crack the whip on China. As the world waits to see if China's new nightmare could ripple across the world, it is a good time to remind ourselves that the WHO has largely failed in protecting the world. Failure number one. The WHO declared a global agency at least a week too late, totally allowing the initial spread of the coronavirus beyond China, a crucial week that made a devastating difference. The second major failure was the WHO's disastrous policy advisory that travel restrictions should be the last resort. This epic error practically delivered the virus to every corner of the world. The third major failure was the WHO's bumbling initial advisories on the droplet transmission, confusing countries and governments and leading to a disastrous lack of clarity on precautions. The most epic failure by Dr. Tedros and the WHO has been the organization's hurried approval of Chinese vaccines, which have now proven to mostly be subpar, if not completely useless, and fueling the huge surge in caseload in China. What made this worse is the WHO conversely blocked and delayed access to India's Covaxin, which has since proven to a far more efficacious vaccine than many of the others that the WHO eagerly approved under pressure from countries including China. Above all, the WHO has operated like a vassal of the Chinese state, barely criticizing the openly draconian and bungled zero COVID policy of the Xi Jinping government, and in many cases defending Chinese policies. It's been 3 years since the Wuhan virus went out into the world, giving global citizens their worst living memory. As India and the world navigate next steps in the battle that clearly isn't over, it wouldn't be prudent to bear in mind that those mandated with protecting the world have constantly failed. Bureau Report, India Today.